And Mr. Lee, looks like you're gonna be going home today. How long you been in here?
About 3 weeks.
About 3 weeks?
Mm-hmm.
It took them that long to figure out what's wrong with you?
Yeah.
Did they monitor your mental status and all that too?
Something like that.
Look crazy being here 3 weeks to me.
Hey.
You should've been gone
It
already.
be like that sometimes.
Yeah, I know it, right? So how you feeling right now?
It'll do.
Doing better?
Not really.
Not really? Did you at least eat well? Why you I know this food in here is really good.
It tastes like slop.
Yeah, well, you know, you gotta put that to the side and eat the fruit. All right, so it looks like you got diagnosed with hyperparathyroidism. Have you had that a long time, or is this new for you?
It's new.
It's new?
Mm-hmm.
You know anything about it?
No, not really.
Well, you know, your parathyroid's overacting is causing a increase in serum calcium levels, so your bones develop it. So the things you want to look out for is going to be your bone density. So there's a chance that your bones might become brittle. You got to be careful with any kind of trauma. You can break the bones, all that kind of stuff. Looks like you're also having some trouble with some kidney stones and gout. That gout's rough, ain't it?
Yeah.
Yeah. Do you know what you got? Have you had gout for a while, or is this new to you?
No, I've had it since 25.
You done had it since 25, so you know what you gotta stay away from, right? Them red meats, organ meats, all that kind of stuff.
That's what they say.
And you know, it's a shame though, because that's a good food, right?
Yeah.
What we gonna do about it? We got you on some allopurinol, looks like. Well, so the allopurinol, how long you been taking that?
For 25 years.
25 years. So you know you gotta monitor certain things, and the meds they got you on, I'm kind of curious, but I just want to go over them with you real quick before I send you out into the world, okay? So, you know, you're going to want to make sure you monitor your blood pressure good, because they got you on some blood pressure medicine, allopurinol, and a hydrochlorothiazide, all of which react with your blood pressure. Okay, so you're going to want to make sure that your blood pressure stays good, so I want you to check that at least once a day, okay? Okay, so your Norvasc, you know you're supposed to take at night, right? All right, what you going to do before you take it?
I guess I'm gonna drink some refugees with it.
I would recommend against that. I would recommend taking your blood pressure before you go to bed, at least at night, before you take your medicine, right? That way you don't bottom out at night, then we had to call the paramedics. You back up here again, your foot hurts, you got the kidney stones, you done broke a leg because you got dizzy because allopurinol and the hydrochlorothiazide all cause dizziness, right? Then if your blood pressure drops, you're gonna try to get up, go pee. There you go, done fell in the bed, got a broke femur. You're gonna be in here for another 4, 5, 8 weeks, okay? You're only 50 right now, but you know, when you get 60, 70, that's gonna be a rough time for you.
Stuff happens.
So, do you try to stay off of your red meats and all that, or
Well,
you one of these that gonna be like, I'm gonna eat what I want to eat when I want to eat it?
well, you know it's football season. You gotta do what you gotta do.
You gotta go eat them hot dogs.
Right.
Yeah.
It's tailgate. It is what
You gonna
it
be
is.
tailgate?
It
You go
is
out
what it
tailgate,
is.
so you drink some of them cold cool beers?
You better believe it.
Yeah.
Got the whole 12-pack weight
That's
on
what
right
I'm telling you,
now.
and that's good. You're gonna have to at least have somebody by your side, because the alcohol interacts with your meds you're on, right?
Well, I take my meds,
Yeah.
then I take my beer.
I take my meds with my beer personally.
Well,
That's just the way I do it, but you know, what works for me might not work for you.
well, it's been working for the last 25.
Yeah, so you know, I would go over these nutrition recommendations for you that the nutritionist set up, but you gonna do what you want to do anyway, right? I'm gonna tell you anyway. That way, when you leave here, you can't say that, hey, Chris didn't tell me not to eat these red meats because it increased my gout. All right, so I'm gonna go over here. They got this here. We gonna read what the dietitian said.
Okay.
It's kind of like the weatherman. The weatherman said. I'm just telling you what it said. All right, so it said avoid the red meats, organ meats, dairy and eggs. They say avoid peas and legumes. I personally, I'm not gonna do that. It says try to eat lean protein instead of chicken, turkey, beans, fish. That's good stuff. You like chicken, don't you?
Oh yeah, especially when it's grilled
I bet you on this grill.
and fried.
I'm gonna eat
And
me
laid
some
to the
fried.
side.
I'm eating me some fried chicken personally. I like fish. Fish is a good way. You know, you can put that in your diet. You like to eat fish?
Yeah.
I bet you eat it fried
You
too.
better believe it.
Maybe try some grilled fish.
No, I ain't doing none of that.
You don't like no grilled fish? Well,
That's slop.
that ain't no slop, man.
That's
You
they been
just
feeding me
sound
up
like
in
my
here.
kids.
They have feed me in here. I can't wait to get back to that fried.
How about coffee? You drink coffee, tea, sodas? stuff like that?
Yeah, I had my Mountain Dew earlier, so I keep snatching it.
Oh, was this it right
Yep.
here? Okay, we're gonna throw that away. You wanna drink some
Yeah,
water
break
before
your
you leave
legs.
here? So, you know, those go increase your risk for kidney stones.
Yep, that's why I drink them, but it's ice.
That's why you drink them, cause you like kidney stones?
So I have my Mountain Dew,
Uh-huh,
and then I have my water,
okay.
and then I have my Mountain Dew, and then I have some more water.
Now, where's the beer fall in this?
It falls between 12 and 4 o'clock. every
12
day.
and 4 o'clock.
Every
So
day.
after lunch, but before dinner.
That's right. And then sometimes a nightcap.
No wonder why
Grandma
you eat
pick me
these
up.
red meats. You drink so much you can't remember not to.
Hey, I gotta do it, gotta do it.
All right, so you want to avoid excess calcium. And you know what? Do you ever have any trouble with heartburn or anything like that with all this fried chicken and all that? Okay, well that's got calcium, so you got to be careful with your Rolaids, Tums, all that stuff. All right. All right, so I'm gonna want you to follow up with your primary care physician because there's some labs you want to be monitoring because you're on some loop diuretics, you're on this hydrochlorothiazide, and it can cause some decrease in sodium, potassium, all that. So you want to make sure visit your primary care physician. Okay. Now, see, they got you on these meds. Some of them interact with others. Like I said, you're gonna want to monitor your blood pressure. Everything that you're not gonna do, I'm gonna ask you to do, because we just discussed it. So you're on Norvasc, right? How long you been on Norvasc?
I've been on about 10 years.
All right, did you have a high blood pressure before you started any of this other stuff, or did that come after?
I've been here and there and everywhere.
Yeah, well, the parathyroidism can lead to hypertension, all right, because of calcium in your blood. So that's a calcium channel blocker. So it's kind of holding it out there, keeping it from getting in your cells, which, you know, neither here nor there. I'm not the physician, but that's what they prescribe you, okay?
Now I'm gonna tell you,
No, okay.
since I've been taking this Alolopine Norvasc, I've been having some swelling in my ankles. And I told the doctor about it, but he didn't say nothing.
He didn't say nothing about it? He didn't tell you nothing about the swelling in your ankle?
Nope.
Well, like I said, it increases calcium. It holds the calcium outside the cell, so that retains water. So you're having some water fluid retention. All right. So you know it's kind of a double-edged sword. You need to drink plenty of fluids because you got the kidney stones and the gout. Now, is it painful or is it just fluid?
No, it's just fluid.
It's just fluid. Okay. But do you exercise any, or you just sit there on that tailgate and drink your beer?
Hey, I be running for that beer.
I know you ain't running for no beer because if you like me, you sitting right there in the cooler right beside you.
Running for that beer.
Yeah, I don't run for my beer. I just sit it right beside me. And when I run out, that means I'm going to sleep.
No, going to get some out.
You're heavy. You're hard. You go hard.
Oh,
Yeah. You got anybody there with you?
So it'd be me, it'd be my brothers, my brothers.
Is anybody else there that ain't drinking so that when you fall down, they know to call the
So,
ambulance and tell them you're going to have a broke hip?
So, you know, my daughter's a nurse.
Okay.
So she kind of like educate me and all that good stuff like that.
Well, tell me what you know then. Tell me what she done taught you. Maybe
so I do know
okay.
with my hydrochlorothiazide that I do supposed to drink my water, which I do. And I do take my blood pressure like I'm supposed to. And it does run normal and everything. And one time my blood pressure did bottom out. And they dropped me down to 12 and a half. And then they dropped me on 12 and a half, and that's kind of like how I got on the 5.
That's wait a minute now, you throw me all over the place. You started with hydrochlorothiazide
by itself
first. All right.
And then it started bottoming out because you know it does remove the fluid from the body.
Yes, we do.
And so then my blood pressure started bottoming out to like 90/60s or whatever like that. So and then that's when the Alolopine came into play or whatever. So there's like, well, we're gonna drop it down to 12 and a half. And then we're gonna put you on the Alolopine, which is 5. So that's what we did. So we did that for about, maybe about 7 to 8 years. And then my blood pressure started creeping back up. And then he just bumped it back on 25.
He put you back on 25? Okay. So your blood pressure bottomed out. Tell me something about it. When did that happen? Were you drinking the night before?
And see, that's the thing. I had actually stopped drinking.
Really?
Yes.
I don't know about that.
I had actually, believe it or not, I had actually stopped drinking.
Just choose not.
I had said I was going to give it up for the Lord.
And he
And
gave you,
then-
then he fooled around and struck you with his parathyroid.
Yep, and then I said, yep, that.
Yeah.
I just started back.
Well, just in case you don't know, alcohol can cause dehydration. You know, but I ain't even gonna go into
Yeah,
it.
and then that's when I said, and see, then that's when my addiction for the Mountain Dews came in when I gave up the beer.
Oh, well, I can't say nothing. I like Mountain Dew too.
So hey,
It's full of sugar though.
yeah. So I was
You
like,
gonna fool around
Mountain
catching
Dew, beer,
diabetes.
water. Hey, you gotta do what you gotta do.
Yeah.
What you gotta do.
Do you exercise any besides going to the beer? Do you try to walk? or anything?
I do. I walk.
Okay, you walk because you know want to keep your calcium level strong, keep your bones strong. This disease you got's gonna affect your bones, so you need to try to stay active, walk, exercise.
Now let me tell you something. So since I do
Talk
like
to
this,
me, lady.
since I do take this Imperial,
Do Mountain Dew.
and I do my do. I do. Now, with if I eat this chicken,
Yeah.
and I do eat it in moderations, and I do like it fried, and I do like it on the grill,
Some like it hot.
on the top.
Okay.
So, let me say, so,
Look, I got another patient I got to do.
hey, but no, I don't, no, but I need this time.
All right, come
This
on with
time.
me. I'm here with you.
So,
I'll be
with
here
the,
long
with the
as you want.
chicken,
Yeah, that chicken.
so when I eat it grill, when I have it on the grill, I don't have any problems with my gout.
Yeah.
But when I fry it,
Mm-hmm.
that's when my gout flares up.
Yeah, well, it's because you get all that grease and oil and all that in there. And,
But I don't cook it in vegetable oil though.
well, you cook it.
I cook it in canola oil.
Okay, so I don't care. It's still oil.
But they say canola oil is good for you.
Well, I mean in moderation, but if you got dripping chicken, it's running down both sides of your cheeks.
But
Come on
no,
now.
I let it sit
You let it sit.
and I let all the grease drain out.
Oh, yeah. You think it's all gone just because you let it sit?
Yeah.
Oh, yeah, no.
So you telling me I can't have my fried chicken? That's
I'm
what
not telling you can't have anything because you're a grown man. I would call you woman because that's what you look like, but we're gonna go with what your name is. You're grown man. You have what you want to have. I'm just gonna tell you that it's gonna affect your life in an adverse way. So, in moderation, some things are fine, but if you overdo it, you know it's gonna be bad for you. Now I know you don't like the gout. I know that hurts. You got any flare-ups right now?
No, actually, when I have my flare-ups, it's not in my foot; it's in my elbow, and it's only in my left elbow.
Well, maybe it's tendonitis from eating all them chickens.
No.
It might not be
No,
gout.
no,
No?
that's not. It's gout.
Well,
Because
maybe
they
if your
chicken.
gout was there before you got to your chicken, you'd have trouble eating. You wouldn't eat
No, it
some
ain't
more
none of
time.
that because I tried to do the right thing.
Huh?
But my ibuprofen.
What about you, ibuprofen?
Now, my
You wanna know about
ibuprofen. Yeah, no. Well, they told me to take 400,
Yeah.
but I cannot like be taking more than that.
You kind of be taking more.
Yeah.
Yeah, you and the rest of the world. You
So,
know, different than how much you take? And what's the deal? Tell me something about
So they tell me to take one
One 400 milligram tablet,
Uh-huh.
as needed.
as needed.
Uh-huh.
So
How often you need it?
I've been needing it kind of often.
Okay.
Sometimes I take up to about 10.
What? You did just 10 at a time? 10, 400, that's 4,000 milligrams of ibuprofen.
Yep.
What kind of TV shows you been watching?
Grey's Anatomy.
Oh yeah, stop. Well, you know, ibuprofen is an NSAID. For one, it does help with inflammation, so it will help with your gout. But it also is hard on your GI system. It causes a thinning of the blood, and you know, you cause some bruising, different things like that. So don't be taking no 4,000 milligrams, 10 of a whole handful at a time. You just turn the bottle up and swallow it.
Hey, you gotta do what you gotta do.
I think it's from your drinking. I think you're just not drinking too much and taking too much medicine.
No, but see, I told the doctor I needed something, and he just said take the
He
ibuprofen.
didn't prescribe you anything else? No Mobic or anything like that? You take one at a time? I'm surprised he didn't put you on Mobic. That's a really good drug. for you.
I know. My daughter said the same thing, but he won't put me on it. He said take the ibuprofen. Yeah,
He's scared you're gonna take 10 of them at one time. Did you tell the doctor you did that?
I did.
You told him.
Mm-hmm.
What'd he do? Just like, click my pen and go to the next
No,
patient?
he didn't believe me.
He didn't believe you did?
That's what I'm telling you. That's what I'm telling you.
Well, what's the thought pattern there?
They helped my pain.
Yeah,
It is.
10 of them have you paying.
Mhm.
Well, they're gonna cause you some more pain to keep on. I'm just gonna let you know, you're gonna end up with some ulcers, you're gonna fool around. As soon as you fall and break your finger because you won't listen, you're gonna be bleeding out. So, you're gonna wanna stay away from it. I'd probably maybe try some Tylenol or something. Talk to your doctor about getting on some Tylenol.
Well, see, it's the thing, which I did not disclose this in my history, but.
So you ain't telling us all we need to know.
They
You're a normal patient.
didn't ask.
They didn't ask, okay.
You didn't ask
Well, I'm
me.
asking now,
You
tell
told
me, I'm here to listen to you, you already told me you need this time.
So you know, since I drink all this alcohol and everything, nobody checked my liver functions. I've been complaining about my side been hurting.
Really?
Mm-hmm.
Well, it's probably trying to excrete all that doggone ibuprofen.
Probably is.
You know, you're gonna have to help yourself if you want this medicine to help you. Medicine's just to supplement, you gotta help
And
yourself.
that's why I've been here for 3 weeks, and I've been telling them about the pain. Nobody won't give me no CT scan. Nobody won't give me no MRI, and I have freaking good insurance. I work for the freaking state. I have Blue Cross Blue Shield.
Yeah, well, I think you
Nobody give me what I
Okay.
need.
Do you have a primary care physician?
I do.
You do? You go
And
see him?
that's why he sent me here, so these dinglings can help me.
Nobody
Nobody is listening.
They ain't do you no justice.
Nobody.
Oh, well, I think you should definitely follow up the primary care physician and tell him, does he know you having side pain and that
Yes.
you like make a whole diet out of ibuprofen?
Yes. And that's why he sent me here, because he don't have privileges here.
He don't have privilege.
No, he does. They took, so, long time ago.
Oh Lord, I don't even know all that. I don't need to know.
Long time ago, primary physicians, for some odd reason, could not come in the hospital to see their patients to write orders. So they're left to the devices of the hospitalists. And he sent over what they need to get done, and they said, screw this, we're gonna do what we wanna do. And what my doctor said need to be ran, they did not do. So that's why I've been sitting here for 3 freaking weeks, trying to advocate for myself.
Well, that's
And I've been
terrible.
telling
I didn't know this hospital did stuff like that. I think I'm gonna have to go work somewhere else. Where's your primary care physician work?
He works down the street.
He hired?
Yes, he
I'm
is.
gonna have to go see about him.
And
He
because
sounds
of
like
my
he knows what
insurance,
he's talking about.
Yes.
Now, can he send you directly for a CT scan? Can he write an order and get you sent for a CT and get your liver checked? I know he can test your liver function.
he can't, but because I have all these other issues, my insurance said that I need to be admitted. Because if it's anything, if I have to have surgery, they want me to be already here.
Well, I mean, they can do the surgery for parathyroid. That's the ultimate probably, is to remove the parathyroid glands. And then it'll help improve your symptoms. But you know, with any surgery, there's complications and there's adverse effects from everything. You know, you were born with it. You're supposed to have it. Just because it ain't acting right don't mean you just get rid of it all of a sudden. But,
Yeah.
you know, so there'll be complications with anything you do. But it sounds like, one, you need to go back to the primary care physician and tell him what happened up here at this hospital. And that he hadn't done it, and he could follow up with the labs that he feels like he needs that they didn't do. Check your liver function, because, you know, if your liver's good and you can, Tylenol will help your pain, that'd be great. But I can't tell you to take anything until you get all that checked and checked with your physician. All I can tell you is this is what they sent you home with, and you gotta be careful with monitoring your blood pressure. They got you on this vitamin D, which increases calcium absorption. You know, it also leads to more kidney stones and more gout. So, you know, you had a double-edged sword right here.
Yeah, no.
So, you know, you probably ought to be looking at that diet and that alcohol use and all that. Now, I ain't throwing no stones because I live in a glass house. So, I'm just saying what the book says you should do.
That's what they say.
Yeah. So, you got any other questions for me?
Mm-mm.
Okay, because it's lunchtime. I need to go eat lunch.
Yes.
I'm gonna go get me some fried chicken.
Well, they get
You want some
fried
help
chicken.
out? I'll get you a wheelchair. You need a wheelchair, girl?
No.
You going straight to see your primary care physician?
Yes.
You gonna do that for me, right?
guess.
I want you to be alive next time I see you. I don't want me walking by and you over there broke hip up here in traction.
Maybe.
Got here getting surgery and you gonna bleed out from surgery because you eat a whole bottle of ibuprofen before you showed up.
Maybe.
Yeah.
Okay.
Lower your ibuprofen dose. I know it helps, but you can't take all that like that, okay?
I see.
Take your meds like you're supposed to. Take your Norvasc at night. All right. Take your blood pressure daily.
Okay.
Drink plenty of fluids. stay away from organ meats, okay?
That's right,
Do your best.
that's right.